Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. We're here with a super special guest today, Dr. Diana Mercado, and I'm just going to let her tell us a little bit about herself and her journey to medicine.
Awesome. Thank you so much for having me today. I'm Dr. Diana Mercado. It's a pleasure to meet you. I'm a family medicine physician. I'm the chief medical officer of my hospital in Texas, and I'm also the clinical medical director, and I'm the nursing home medical director. So I have a lot of hats. I am a mom of a 2-year-old and a 4-year-old, and I'm a first-generation Mexican-American to go to college and to go to medical school. And I guess probably the reason I was able to do all that is because of the diagnosis of ADHD, because somebody who has ADHD tends to be a little bit outspoken. You kind of say what's on your mind before you have processed that you already said it out loud. And because you're kind of saying stuff, sometimes you automatically get elected as the leader, So that's how that sometimes happens. But, I didn't even put 2 and 2 together. My symptoms of ADHD had been there all along since I was a child. I remember my dad would be mad because he would have to come out of his work. He's a welder, and he would come and sit there because I wouldn't stay still. And so even though the teachers would give me lots of work and I would do it, and they would give me more work and I would do it. And so they just had to bring my parents in to sit me down. So never did it even cross my mind that maybe there was something like ADHD, because I learned English as my second language at the age of 10. I learned it. And so even though I was born in Texas, I grew up in Mexico till I was 10. And so I was pushed back, and then I did well because I was curious and I learned, and they never thought that my inactivity, because quote unquote, I'm smart, would be tied to ADHD. So I bring this up because all along, I think it got missed, because then I was in high school, and because I was in the cross country team, and I was in the volleyball team, and I was in the dance team, all that gives you dopamine, which like anything that you're super motivated at, you're going to do really well. And so I was doing really well in my school. I ended up number 7 out of like 700 students, and I got a good scholarship, went to a private school. And so all along I was missed. And then of course you get to college, and then you're working hard, but you think, well, it's because wherever I was at was probably not the best education, and now I'm challenged. And so you just keep working hard, and you keep getting tutors, and you keep talking, but then you hit med school. That's when I finally hit the wall, so to say. And it didn't matter how all the techniques that I had done before were just not enough. And so I was finally told by one of my roommates, hey, I see you studied 80, 90 hours. I don't know if you're just not sleeping. That's why you're not retaining information. Or are you just stressed because, your dad just got diagnosed with cancer? Or are you so anxious because you keep telling yourself you're the first one in your family, like you can't fail everybody? And so it was because of her just saying, go get help, go see what's going on. It might be nothing, or it might be something. And that prompted me the diagnosis. So I bring this up because if you are somebody who is already a college student and has the diagnosis, or if you're starting medical school and have the diagnosis, please take advantage of figuring out how you best learn. Because for me, when I got that test done, I got told, oh, you're a spatial learner. So you need to be able to draw stuff. That's how you retain stuff. And so looking back, I would do my notes in a different color, like anything that was not a like was a different color, like I had red stuff or anything that was positive or whatever catalyst, I would do in green stuff. So spatially putting things and dissecting the information and looking at pictures was what would help me figure out the things. So it's important to know, like, how do you learn so that you can use and tap into those strengths instead of like, fighting against the current, so to say. So that's important. I wish somebody would have told me once I did get the diagnosis that other than medications, that there was a lot of other things that you could do, like that you could go to therapy, or you could get an ADHD coach, or you could find apps to help you with reminders, or that you could use timers, because sometimes we don't have a self-awareness. Like there's only two types of times, like now and not now. And so it could easily, anything that you do, like you can, it's a misnomer with it, because you can hyper focus and you spend a lot of time on that, and you can get engulfed and you can lose sight of the rest of the world. But the stuff that are a little bit boring can be problematic, because then that's where the disconnect happens. Like people start to judge you and say, but I just saw how great you did in that class. How come you got an A there? And then this other thing that quote unquote is boring or just not of interest, like how come you're flunking it? Or why can't you just do your laundry? Or why do you keep losing your keys or your phone or different things like that, So that's how I got diagnosed with ADHD. I actually was very ashamed of the diagnosis when I got diagnosed, because in my mind, I'm the oldest one, and I thought I had to be the example of the perfect child. And in my mind, being a physician meant you had to always be on point. Otherwise, if I forgot something or didn't do something right, like I could endanger my patient, right? And so I had an inner critic in my brain telling me, like, you better get it together, or suck it up, buttercup, or it doesn't matter how long it takes you, you're going to get this right. But it was not a friendly voice. It was a voice that was kind of like, a voice of fear, right? And in the last year, I've discovered finally, so I knew I had ADHD. And after I finished residency, when I became a full attending, got told, well, now you're an attendee, you need to have a new physician to be your physician, your psychiatrist. Well, that new psychiatrist, I picked a random person out of a hat, told me that I should know better, that I outgrow ADHD. And I didn't question them. And that's what led me to ignore my own diagnosis for the last 8 years. But with the pandemic and everything, everybody is tired, right? I just gave you all the titles that I was carrying. And when you are not aware that there's other ways to help yourself other than medications, kind of like the ones I just said out loud, then you just keep punishing yourself mentally, because you feel like I need to get it together. I need to hold it together. A lot of people are counting on me for this, but you never give yourself that self-care that you need, right? Like, whereas students, we tend to give and give. As physicians, you do the same thing. Like, it's hard for us to ask for help. Asking for help is actually a sign of strength, because it makes sense, right? Like, I'm not gonna try to like fix my car if I don't even know how to fix the car. So why would I try to like do something that is not in my area of genius, right? But somehow just put unrealistic expectations to yourself without realizing, no, like, there's different people that are really good at whatever they're doing. Let's work together and we can figure it out.
I love your story, because you brought up a lot of things that we'll try to hit on, a few of those that kind of all bring it down to the bottom line of you just trying to utilize your gifts and ask for help, because that is okay. And that's something that we should allow. And you started way back when you were in elementary and middle and high school, where you were academically gifted and you were doing a lot of activities. And this kind of helped mask some of your symptoms of ADHD because you were just in a lot of things. So you would think that you were being forgetful or something like that. And they're saying, but she's an excellent student. There's nothing wrong. And then when you got to college, you're studying more and you just think you have to study a lot. And then when you get to medical school, and I'm sure everyone has heard this analogy or something similar where there is so much information where it's like you're kind of trying to drink from a fire hydrant, that you have to have some kind of technique or things are going to fall apart. So things became similar to that for you. And I'm not going to speak for you. So maybe you can give the students some examples of what you were experiencing in med school that prompted your friend to tell you to reach out for help. Because I have a few friends, or one of my friends always tells students when we go back to speak at our old medical school institution that everyone, when they go in the front door, should get a neuropsychological test to see what your learning styles are, or if there are any issues, to just start ahead of the curve before you even start to do your studies, because everyone has different needs and you should know how to study according to that. But of course, I'm assuming when you started that didn't exist, and it definitely didn't exist for me. So can you tell the students a little bit more of some of the signs you were seeing so that maybe some listeners out there aren't also recognizing that they may have some of these as well?
Yes, that is great advice that your friend is offering, because yes, just the more you know about yourself, the easier it is for you to step in your zone of genius, right? And whatever doesn't work, then why keep trying to do the same thing that is not working, right? So that's amazing that she offers that advice. But what my friend was seeing and what I was noticing was that I think we had done one set of blocks. They call them blocks, like, I guess I think there's 2 or 3 blocks per semester. I want to say a block is like a month or 6 weeks. I can't remember. It's been a while. It was 2004. It's been a little while. But in my school, the first 2 years were like books. Like you went and did a little bit of physical exam here and there, but it was mainly books. And then the next 2 years, it was all rotations, right? And so it was the first block, I believe, or the second block, I can't remember exactly, where I got some grades back, and some of them were C, some of them I don't think I had passed. But when I looked at the thing, I hadn't finished like the test, like I had ran out of time. And whatever I had done, like I had gotten right. And some of them I had right and I changed because I was second guessing myself. It can't be that easy, you know? And so I wasn't sure if I was like over studying again, because I was so anxious and so nervous, like, oh my, because we all know, right? Like we get all these awesome loans that we one day have to pay back, right?
Great ones.
And we feel all this pressure, like all this pressure of like, it doesn't matter if I pass all my tests, like I still have to pass a board exam, but I can't even pass a test. How am I going to pass a board exam? So all those things, like your brain is so nice at pointing out how you're danger, you're about to die, right? And so again, I wasn't sure if it was anxiety because my brain was so good at going there, right? But it was mainly that I would read and I would have to read the page probably like 4 or 5 times. I would get lost in the paragraph. I noticed that if I just got curious with looking at the titles, like stepping back and trying to put the big picture together and then like digest the details of whatever was coming, it was easier because then I had a frame of mind. But if I just started reading, because like you said, it was so much data, like I remember I was shocked that we had covered, I think it was like molecular biology or something. I had done that in my college a whole year. We covered it in 3 weeks. And I was like, I was like, wait, what? How do we cover like, and more, like that and more? And so then at that point, I realized why they say that you don't need to be a biology major or a chemistry major. Like you could be whatever, because the amount of information you're going to learn is going to be crazy. But I say this so that you know that once you're there, you adapt, but you have to know how you learn, right? Because if you don't know, again, it's just that much harder. So it was that I couldn't remember details. I couldn't finish the tasks. And then I was second guessing myself. And of course, I couldn't even remember where I had left one of the books or whether I had read that book or whether I understood the question, because sometimes they would say like double, it was a multiple choice and it's like, this does not, da, da, da. And I was like, wait, what? Like, it was just too much. Right. And so, and again, like I told you, I don't know if I told you or not, but my dad had diagnosed with stomach cancer at that time and during the first semester of med school. And so it was a lot of stress and a lot of new stuff going on. And I was flying home every weekend because driving would mean 7-hour drive each way. Flying was a 45-minute flight. And so I would try to leave on Friday evenings and then fly back Monday, 5 a.m. because it was the cheapest because you're a medical student. So you're trying to like just conserve. So diagnosis of ADHD can be missed, especially in females, because we tend to be super hyperactive and then we go through through our period. And then all of a sudden we're just a little bit more dreamy. And so we're not creating such chaos as before. And we might be still active, like running or dancing or doing something else that's going to give us that dopamine. And then we get to college and guess what? Food becomes our dopamine, right? And so there's just different ways that you are doing that and it gets masked. And then usually females, when they have the birth of their first child or when they get to medical school, law school, or when they all of a sudden get like promoted, they have more and more organization and executive function that needs to happen. And so things just start to pop out.
How did the diagnosis of ADHD change your trajectory or your performance once you were actually diagnosed and treated?
Yes. So once I was diagnosed, the medication right away. My God, like this is why it's important if you are feeling like there's something off, like if you're feeling a little anxious, a little worried, a little depressed, you can't concentrate, go get the screening test to figure out if it's anxiety, depression, ADHD, because the diagnosis is so important because there's different medications for each thing. For ADHD, the medications that you take, like within 30 minutes of you taking it, you have what your body needs, right? And so it's not like anxiety and depression where it has to build up 3 to 4 weeks for you to start to see a thing. So here's the thing. If you're smart, they might not even think ADHD. So you need to be aware, and I can send you a screening questionnaire if you want. Of course, we're not their physicians, but at least they can see a questionnaire and then they can go to their physician and see, hey, of these 18 things, I see that the top ones kind of show that maybe I have ADHD. Let's look into it, right? Mm-hmm. Because it's hard to decipher if you're anxious and depressed because you can't concentrate, because you don't feel like you met your potential, mm-hmm. or the other way around, like you have ADHD and it's not managed, and then and you do have a tad of like depression in there too. So it can definitely coexist. But getting the medication was life-saving because I don't know if I would have graduated medical school, mm-hmm. had I not known I had ADHD, right? Despite me feeling whatever I was feeling inside, like ashamed or whatever, I was still able to take the medication to help me to function long enough or good enough to be able to pass and graduate. Mm-hmm. I did fail step 1. I missed it by a point, but at that time when I took it, my dad had passed away with, I don't know, it was 2 or 3 weeks after that happened. So that also tells you how sometimes when we are so in whatever, like we keep going, right? And so this is another point to bring up. Like we're human, like we're mm-hmm. not like these superpower machines. whether you're a medical student or a college student or a physician, we're all human, and we do need to take the time to like slow down, regroup, and then go forth. But I didn't pass that test. But then, you know what? I was like, well, I'm going to go take this other, like similar to Kaplan, where you take for an MCAT, you take a different test where you study to take the USMLE. It was only 1 point, but I think I was so scared again of like not passing that you do whatever you need to do, right? But I think had I not had the diagnosis, then I wouldn't have had the medication to help me to concentrate. But this is why I bring this up. Had I known that there were, other than medication, there was other things that I could talk to somebody who was going to explain how my brain works, how, you know, when I think of a project, I tell you it's going to take you 15 minutes, but I'm telling you, I haven't told you because I didn't even know to think of like, what do I need to get ready to start the project and what do I need to complete the project? I'm just telling you the middle part, right?
Yeah.
And so understanding that there's different parts, then you can more adequately time for stuff so that you're not missing deadlines, so that you're not forgetting appointments and putting it into your calendar and, you know, things like that. Today, I would tell you that I think it's a gift to have ADHD. Today, I feel like ADHD is a beautiful gift, but you have to know how to unwrap it. So that's why you need to make sure you study yourself. But I do think that ADHD is what has allowed me to be a leader, what has allowed me to think outside the box, what has allowed me to not be so judgmental with others when I see that they had to try 3, 4, 5, 10 times before they figure something out. Because I really honestly believe that everybody wakes up and is always trying to do their best. Nobody says, how can I mess up today? Like nobody's saying that, but sometimes things happen and it's because they get missed. You know, last year I learned that people with ADHD, if they have it and they're not treated, like you can lose 21 years of your life. Like you can die from an unnatural cause because you're impulsive, you know? You can die in a car accident because you're speeding, because you're late, you know? So when I learned that, I was like, oh, I better stop ignoring myself because I was driving my kids back and forth. I said, I don't even smoke. Why would I like put my kids in danger on the road, right? And so that was like a wake-up call to me when I learned that at a CME conference, which is a continuing medical education. They were talking about adult ADHD, and that stopped me on my tracks. And so from then on, I decided to do the work on myself so that then I could turn around and help, you know, medical students, physicians, to not feel ashamed that their brain thinks a little bit different, and to encourage you to seek therapists, seek a psychiatrist, seek a life coach, because that's their specialty. Why not help yourself to get the tools that you need so that you can turn around and function? And I think the most important thing, if they were to take away from this, is that if you do have ADHD, or even if you don't have ADHD, we all tend to be type A and we don't have timing for ourselves. But scheduling that free time in your calendar, and you put on there, meeting with a CEO. You're your own CEO of your life, right? Right? Like nobody else is, unfortunately. So you need to respect that block, because unfortunately, that's the first part that goes when something hits the fan. Like that's what you give up, right? But if you don't fill your own cup first, nobody's going to come and pour it into you, especially because we already talked about how we don't like asking for help, right?
Absolutely.
So you got to.
I think you brought up so many interesting points during this discussion, and it just talks about, I'm going to bring up 3, but it just shows like I'm thankful that you were able to sit here and talk, because I can't imagine how many other students out here are listening have gone through similar things or will go through similar things. My first thing you brought up is humanity. You have been in your first 2 years of school going back and forth with home with your father who was terminally ill, and then you lost him and you kept going, where in hindsight, of course, family comes first and you were doing what you had to do, but maybe the alternative would have been to take some time off. And I think a lot of times with that, I personally, my grandfather had cancer when I was in my first year of medical school. And I also I didn't go to his funeral because I had a test. And if I would have just asked for help, 15 years later, I probably wouldn't still be talking about that. But you're human. And that's the part that I was going to get to. We all want to live on a timeline because we're type A type people. And it's okay if you have to take a semester off if you need to for yourself or for family. The second part is second chances. You mentioned that you studied well and you were 1 point away from your step one. I was 2 points away from mine, for full disclosure. So you guys out there, it's okay to take it a second time. You see all of the different job titles that Deanna has, and you guys have heard all about me. So there's hope on the other side. You will be more than okay. And the third part that you brought up is studying yourself. No one knows you better than you know you. And with all of these different gifts that you have, sometimes that gift can be of masking certain symptoms or things going on with yourself. So be honest with yourself, study yourself, step up for yourself, because if you don't, no one else will. So you can be your biggest and fiercest advocate. And in order to do that, you need to take time for yourself, time to reflect and time to think and to figure out ways in which you can empower yourself to perform well and to just take breaks. So that's my little soapbox about that. But I think that you had a lot of fascinating things. You did mention that there are different ways to support ADHD, one through medication, seeing a psychiatrist, seeing psychologists, but also coaching. You are an ADHD coach. How can that impact living with ADHD as opposed to therapy or medications?
Yes, that's an excellent question. And like I said, it's not meant to be in substitution for it because they all have their special place. So medications are going to give you the hormone that you need that your body is kind of low on. It's probably dopamine and norepinephrine, You take the pill, depending on which pill you take, if it's short acting, it'll be out of your system in 4 hours. If it's long acting, 8 to 12. Now we even have Madeas, which is 16 hours long. So that's helpful. But therapy will help you with understanding your past, like whatever happened or, your childhood type of thing, like whatever you went through, whether it was hard or easy or whatever, it'll help you understand why you're acting the way we're acting today, right? So it'll help you understand, heal from that. Coaching, on the other hand, is more about exploring your brain and exploring how certain thoughts are going to lead to an emotion, and that emotion is going to then give you actions or inactions, and then you're going to get a result. So a lot of people, for example, will say, so they'll say a fact. It's the fact that I get paid, $10 an hour. Because I get paid $10 an hour, that's the, some people might think, the thought might be, that's amazing. I got paid $6 before. So this is a raise. This is amazing. And with that thought, this is amazing, then they're going to go and feel happy. And then from there, they're going to wake up early, they're going to show up on time. And the result is that they are striving, right? That's the result. Now, if somebody had the thought, $10 an hour, that's an insult, they're going to feel mad, right? And from that thought of being mad, they might be like, I'm not going to go to that job, whatever. This is pointless. I have better things to do. So they might let go of that job, or they might show up and do half work or whatever. And then so the result is they don't feel fulfilled, right? So notice how the fact is $10 an hour. That's a neutral thing. It's like saying the sky is blue, whatever, right? Mm-hmm. But you don't realize, we don't walk around analyzing our thoughts. Nobody does. And so a year ago, before I found life coaching, I used to think life was meant to be chaotic. What else do you expect? I just gave you all the titles. I was used to being pulled out of the room to ask XYZ question. The phone wouldn't stop ringing, interruption. And then I wasn't medicated. You can quickly see when I would become a witch, right? If I was overwhelmed, right? Because we can, you're just like, leave me be. I'm trying to see my patients. What do you need from me? Like, why is that so critical? Why, like, it's not important. Why are you bothering me? So I say this because if I'm having the thought, I'm late, I'm late, I'm late, or I'm behind, I'm behind, I'm behind, or I'm too slow, I'm too slow, I'm too slow, this is a thought that my brain unconsciously has told me forever in a day. And how does that make me feel? Like crap, right? And so you could only see, even though all my patients would be like, oh, she's amazing, number one doc, blah, 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 blah. And I would keep getting all these awards. My brain was telling me things that I thought were a fact, I wasn't questioning them. And so because of that, that was not allowing me, like I was feeling anxious. That was allowing me to show up well. And then once I realized, oh, it's my thoughts, then I started thinking things like, I hurry slowly. Like it's an oxymoron, right? But at least like, I'm like, okay, I'm more mindful, right? Or I'm thinking, I'm going to be present with my patient. Instead of thinking I'm late, I'm thinking I'm going to be present with my patient. And so now I don't feel like crap. If one of my patients wants me to be on time, I'd be like, well, come see me at 8 or at 2 p.m. at the start of my clinic. Otherwise, you get me when you get me, right? Again, it's not because I'm trying to be disrespectful, but it's that every person requires a different amount of time. And it's in the art of understanding how people communicate and then the art of prioritizing, right? Like, and so that's how things happen. So the question then becomes, why coaching? Well, that's one part of it. That's life coaching. The other part of it is the ADHD part of the coaching, where they explain to you, like what I just told you, that you need to have a recipe, like you need to prioritize what is important and what is critical, or what is important and can be done this week, or what is important and can be done in like 5 months from now, or what can I delegate? Like we tend to be like optimistic. We think, oh, I can do 20 things. And like most people do too. But in our mind, we're trying to do 20. And because we don't accomplish them all, then we feel like, it didn't happen.
Absolutely. I feel like you hit on so many different things. And my favorite part about it is when you were talking about all of these different needs being pulled at you throughout the day and you're just frazzled, but just taking a step back and taking a breath and thinking through like, okay, I can do this. Let's just reframe this story. It's the same story, but okay, instead of me saying that I'm running behind, I am being present with my patients. And one of my mentors in medicine told me once when I was in residency, when I was kind of dealing with similar things where you're always behind and someone always has one extra question, like, these patients, you may have 20 patients in a day or more, but they more likely only have one doctor's visit for that day or even like that quarter or that month or year. So be present with them and then just be apologetic with the next one. And most people understand because it may be their turn the next time to need an extra 10 minutes to cry on or something. Now, you have to not give everyone, for the students listening out there, an extra 10 or 20 minutes because you'll be writing notes until midnight. But it's okay to be present with your patients, long story short.
Yes. And I was that doctor that had 100 to 200 notes open. That was the norm for me. In October, it'll be a year that has not happened because of coaching. Because again, I learned, I didn't know I could set boundaries. Nobody had taught me that I could tell them, hey, text me, don't call me. I will get back to you as soon as I can. I didn't know I could tell my nurse, hey, don't come knock on my door unless I have asked you to knock on my door because you're timing me to be aware that I'm not taking too long. But they would pull me for to sign a physical therapy note that needed to be done in a month from now or something that was not important, but then it distracts you, right? And you can't refocus, or because they pulled you, now the patient thought of 3 other questions, you know? And so you're just like, oh my God, I thought I was almost done with that encounter. And yet you're starting again, right?
Yeah.
Or when you're so distracted and you walk back into the wrong room and you do the whole note, and then you realize, and they said yes, that was their name and that was not their name. And you changed all their meds, and you're like, you walk into the other room and you realize you saw the wrong person because the other person said that it was them, you know? So yeah, so that's the point, that a coach can help point out things that to you are, this is just the way your life is, and you don't think that it could be done in any other way. They just help you brainstorm how you can go back and apply and reevaluate your things. So, never would I have thought a year ago that I would be telling the world. I think maybe 5 people knew I had ADHD, but now I feel like I need to tell the world so that they can realize that, that they need to use those gifts and be willing to support each other. Because if anything, the pandemic has magnified mental health and the importance of being a human and the importance of taking care of yourself. And so this is where you need to make sure that you do, like I said, you're your own CEO. Like, you don't know if your current girlfriend or husband, like if they're going to be with you the rest of your life, because they might change their mind, or again, a car accident might happen, or you just never know, right? But hopefully you will be with you whatever chapter of your life you have left, right? And so with coaching, you realize that it is not your mom's job to make you happy. It's not your job's job to make you happy. It's not your husband's job to make you happy, your kid's job, your friend's job. It's your own job to make yourself happy. And life is 50-50. Some days are awesome. Some days they kind of just exist for not saying another word, right? And that's okay, because to understand pain, you have to understand happiness. It's not 100% like happiness. They keep telling us that it should be, but it's not. And as long as you show up every day and you do your best, what better do you want? Even if your best was standing that day, that was good enough,
Awesome. I think you've given so many pearls of wisdom today, as well as even points of connection, I'm sure, for our listeners. I'm going to leave you with our final question as to what is one pearl of wisdom that you would like to share to those who are in the beginning of their medical journey, whether or not that's pre-med and med school, and how can those who may be interested in either learning more from you or even learning more about coaching and things like that reach out to you?
Sure. Definitely reach out. You can email me, overachievewithadhd@gmail.com, or come to my website. It's adhd-lifecoach.com. I am also on TikTok. You're welcome to come and join me on TikTok as well. I'm the ADHD doc physician there. And so, yeah, reach out. But the most important thing, like I said, is make sure you schedule time with yourself. And it doesn't have to be anything crazy. Even a 2 or 3 minute meditation goes a long way. And going for a walk, getting grounded, just helps you clear your head and just get back into it. Put on a good song that pumps you up and, get back at it.
Thank you so much for that. And I'm just so excited that we had this conversation. For the listeners out there, please click that subscribe button. I will have you guys listen out because in a few months, it will be my 1-year anniversary. So we'll have a link to a website where you can put in a request for a topic that you would like covered, or a reflection, or a question that you have.
I want to say one more thing before you leave. We have to acknowledge how amazing this is that she's doing this for you, because I wish I had a podcast like this when I was a medical student. I went through and I saw all the great people that you've been bringing, even international listeners. I heard that one, and, talking about men's health and all those important topics, and what to do when you don't match. All those are very important things that it takes a special kind of person to show up every week. And it's almost a year that she's been doing this. So you need to make sure that you continue to reach out to her and give her all the love, because you already know life gets in the way and she's still showing up. So
life really does get in the way. Thank you so much for those kind words. And you guys, listeners, you know that I really appreciate you. You can definitely send messages either to our Instagram at Med School Coach or to my personal Instagram, Dr. D Graham, DOCTOR, the letter D, GRAM, and send some requests, some messages, or share some high fives. I can connect you. Or if there are any other doctors out there that you would like to hear from, we're open to suggestions. And thank you so much for those kind words and for coming and imparting your wisdom with all of us. For all those listeners out there, I'll see you again next week. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.